All right. Okay, hello everybody. It's Dr. Alex Earle and it's Hump Day with Dr. Alex Earle. That's right. We are live here at Pure Plastic Surgery, and this is the time I get to spend with you guys and answer all of your important plastic surgery questions, and of course go over all sorts of procedures and what to do before, during, and after, and everything else. Okay, so as you probably noticed from last week, what I started doing is kind of taking this from the patient's perspective. So last week it was the common patient question, which was, how do I go from a SpongeBob to Jessica Rabbit? Okay, and so today we're doing how to get a flat tummy. This is another one of the most common questions that we get. So, doc, I've had 2 kids. My belly, looks like it's big, it's wide, and how do I get back to a flat tummy? Okay, so what we're going to do is we're going to go through kind of that thinking process and to then, decide what's going to be the best option or options for you. Okay, so if you're there, you're sitting, you're thinking how to get a flat tummy. Well, first of all, we got to do an evaluation, all right? And we got to ask a few questions, okay? So we need to kind of get to the bottom of why the tummy is no longer flat, okay? So, of course, there can be some things that happened in the past. It can be, of course, weight gain or, fluctuations in weight. It can be pregnancies. Those are some of the most common reasons why the tummy is no longer flat. So in order to break that down, we got to ask some specific questions, okay? So, question number 1, is there excess fat? So is there excess fat in the tummy area, all right? And the easiest way to kind of figure that out is to do what's called a pinch test. You're literally going to grab your thumb and your index finger, your middle finger, like this, and you're going to pinch yourself, okay? And if you can get a nice amount of skin and fat in between your fingers, well, that probably means that there's excess fat in the abdominal area. So you do a pinch test here, 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 see what you can get in between the fingers there. If you're able to get, certainly more than 1 inch in between the fingers, well, there is going to be some excess fat in the tummy area. So that's question number 1. Question number 2, okay, is there loose skin? Well, if you look at your tummy, are you able to kind of see that skin is kind of folding over, especially folding over that suprapubic area? Or can you kind of move and jiggle and move the skin around? Okay, so if you can see that there's loose skin, it's kind of folding over. Okay, sometimes we call that a pannus, which can be a small pannus or a bigger one. Or the skin, you kind of hit yourself and the skin kind of jiggles and moves around. Or sometimes if you have a lot of stretch marks, that's typically an indicator that the skin is loose or that it's been stretched out in the past, okay? So that's going to be question number 2. Do I have loose skin? Okay? So question number 1, is there excess fat? Question number 2, do I have loose skin? All right? Next, we move on to the muscle questions, okay? Muscles can be stretched out from either weight gain or, very, very common, pregnancy, especially multiple pregnancies, okay? So, question number 3, is there muscle weakness? So muscle weakness is when you kind of stand to the side, you completely relax your belly, and you see what happens. And if you completely relax your belly and it bulges out, okay, then there's probably some degree of muscle weakness there, okay? If you stand to the side and you completely relax and you're already fairly flat, then there is no muscle weakness, okay? So, that's going to be question number 3. Is there muscle weakness? All right, and this actually can happen. You can have muscle weakness without loose skin and without excess fat. It is possible for that to happen, okay, and I've seen it. And so I've had patients that come in where they just have muscle weakness and they say, I want liposuction. And that is not the surgery for them, because liposuction does nothing for your muscles. It does not strengthen your abdominal wall, which are your muscles, okay? So that's why it's so important to ask these questions and to have the correct response to these questions so you can then make the correct diagnosis and offer the correct procedure, okay? And then last but not least, this one's a little tough for you kind of to do at home. You can try, but you need a little bit more experience in trying to kind of figure this out. But you want to check if there's muscle separation. So the muscles, the two, what we call the erectus abdominis muscles, the ones that come up and down through here, you want to see if those appear to have been separated most commonly with the pregnancies, okay? So sometimes you can kind of feel, you can kind of push yourself in between the muscles to see if it feels like it's thinned out or empty there, and that may give you an indicator that muscles are separated. Or sometimes if you're like laying down, so you're laying down in the bed and you go to push up to get up, and you see like a bulge in the middle of your abdomen, that's another indicator that you have muscle separation. Another term for this is called diastasis. So muscle separation or diastasis. So if you're laying flat and you go to like sit up and you see that there's a bulge here in the middle, well, most likely you do have some degree of muscle separation or diastasis. Okay? So these are the important questions to ask, because depending on the answers to these questions is what's going to determine what's going to be the best procedure for you to get that flat tummy. Okay? So if the issue is only fat, so you have excess fat, but there's no loose skin, there's no muscle weakness, there's no muscle separation, well, in that case, then the best option is liposculpture. Plus minus fat transfer can be lipo 360 or BBL, but the solution can be liposuction. Now, if you have only fat and maybe there's a very mild degree of skin laxity, well, then we can do the liposculpture and we can add on some things such as Vaser and or body tight, okay? And these are a couple of things that can be added on to your liposculpture to help with the skin retraction. So as a reminder, Vaser is a machine that uses ultrasound energy. And what that ultrasound energy does is that it basically knocks off the fat cells. It's called emulsification of the fat cells. And it also does impart a little bit of energy, a little bit of heat underneath the skin. And therefore this allows for an easier removal of the fat. So there's less inflammation, there's less bleeding, and there's better skin retraction. Also, you're able to remove more fat because of the process of the emulsification, which are already knocking the fat cells off the surrounding tissues, and therefore you can remove more fat, especially if you're doing high definition liposculpture. It helps you remove more fat, thinning out the areas that need to be thinned out when you're creating those lines, okay? So, fat only or with mild, not moderate or severe, okay? With mild loose skin, then you can do your liposculpture with Vaser plus minus the body tight. Some other surgeons, I like the body tight, so the body tight uses now a different type of energy. It's called radio frequency energy, okay? And it uses radio frequency energy on the surface of the skin and just underneath the skin, so it's like a double prong probe, okay? And it helps and definitely heats up the tissues. It actually has a temperature probe there where you can see, and it'll heat up the skin on the outside up to 38 to 40 degrees Celsius, and it'll heat up the skin on the inside anywhere from 68 to 70 degrees Celsius, okay? And so that action of heating up the skin from the outside and the inside then of course causes an inflammatory reaction, which then allows the skin to retract more. Okay, this is also very similar to J-plasma. Okay, so some surgeons use J-plasma, some surgeons use the body tight. I prefer the body tight because I think it has better safety mechanisms. It has feedback. I actually know what the temperature is, so you don't overdo it, you don't burn the patient. So I like the body tight, but they work very, very similar. They both use radio frequency energy. Okay, so Vaser uses ultrasound energy, and the J-plasma and the body tight use radio frequency energy. Okay, J-plasma and body tight strictly for skin tightening. Vaser does more than that. It helps the skin retract, but it also helps loosen up the fat, so there's less blood loss, there is less inflammation, and you're able to remove more fat and better skin retraction. So that's why I love the Vaser. I love the Vaser so much that it's now mandatory for all my liposuction cases. So if you're having liposuction with me, liposculpture, lipo 360, BBL, Vaser is going to be included in there. It's mandatory for all the patients. Okay? All right. But what if there's anything else going on? So what if there's loose skin, moderate to severe? Or there's muscle weakness? Or there's muscle separation? Or loose skin, muscle weakness, and muscle separation, right? Each one of these individually or any combination of all those, that's going to lead you to a tummy tuck. Okay, because liposuction is not going to fix moderate to severe loose skin. Liposuction will not fix muscle weakness, and liposuction will, of course, not fix muscle separation. And so you can do liposuction, and if you have any of these things going on, you're going to end up with still loose skin, muscle separation, and weakness. You're not going to have a flat tummy, and you're going to be upset. Okay? So, if any of these things going on, then the answer is tummy tuck. And then, of course, there are patients where you have everything going on. You have all of the above, in which case I recommend doing your tummy tuck first. The tummy tuck is going to fix the loose skin, the muscle weakness, and the muscle separation. And then coming back 3 to 4 months later for your liposculpture 360, okay, as a second stage. The next question, of course, people always ask, why not do it all together, doc? Why are you not doing it all together? Okay, there's actually quite a few reasons. First of all, here in Florida, and every state is different, and every country is different, but here in Florida, when you do a tummy tuck, you're limited as to how much fat you can remove via liposuction, and that's only 1,000 cc's, 1 liter, that's it. That's all you can remove according to the Florida Department of Health and the Florida legislature, the laws of the land, basically. Okay? So, that's typically not enough to remove the fat that we need to do to really, create the contours of the body and reduce the body from a significant amount of fat. Okay, so that's one issue. Second issue is that complications go up, right? The more you do, the higher the complication rate. So if you do a lipo 360 and a tummy tuck at the same time, the risk that there's issues with the skin that you're pulling down is higher. So there may be more risk of skin dying or skin necrosis. There's more risk of the wounds opening up, and there's a higher risk also of infection. Very importantly, there's also a much higher risk of blood clots. Blood clots can be very dangerous. It can be deadly, right? You get a clot in the leg or a clot in the lungs, that can send you to the hospital, and it could potentially be deadly. A pulmonary embolism can be deadly. And so that risk goes way up when you combine a liposculpture 360 with a tummy tuck all at the same time. Okay, so you can't really do it in Florida. You're not going to get rid of enough fat, and your complication rate may go up, especially the risk of clots, which could potentially be deadly. I just don't think it's worth it. Not a great combination. I'd much rather you separate it down into 2 separate procedures. And what do I always say? Tummy tuck first. Tummy tuck first. Tummy tuck first. I should go out and put a sign out that says tummy tuck first. Oh wait, I did that already. Okay? All right, tummy tuck first. All right? Then your lipo 360. And when you do that, you're going to have a beautiful flat tummy. And guess what? If you do it this way, also, not only can you have a beautifully flat tummy, but if you want that etched out look, you can do that as well. We can do high definition liposculpture after you've had your tummy tuck. So yeah, we can do the ab etching, and you can have like that chiseled, more chiseled look as well. We can't do ab etching with loose skin or muscle weakness or separation, but once you get that tummy tuck in and we fix all these issues, then when we go back to that liposculpture 3 to 4 months later, we can do high definition ab etching. Okay? All right. So that pretty much wraps it up. So I'm happy to take any questions regarding this or any plastic surgery topic.
Thousands. Okay?
All right.
Let's start with the first. Says, after getting liposuction, how long should we wait to fly back home?
Great question. So a lot of our patients come from out of state, and we even get patients from different countries. We get all sorts of patients from Canada. We've had patients come in terms of the U.S. as far as Alaska and Hawaii. And we get patients from Europe, very commonly from Britain as well. So, how long do you have to be here? Well, you have to be here at least 5 days post-op. So the total time you're here is going to be at least a week, because you're going to come in for your pre-op, which is the day before surgery. Then you have surgery day, and then you have 5 days. So it'll be at least a week here. And the further you're out, then you should consider staying here longer. For example, our patients that are coming from Europe, or we even have patients coming from Ghana in Africa. We recommend that they stay, for 2 weeks.
Can you have diastasis recti without having kids? If
Yeah.
so, what causes it?
Yeah, unfortunately you can. So one very common reason is weight fluctuation. So if you know, increase a lot of weight and then you lost that weight, well, the muscles have already been separated from all the weight gain. So even if you lose that weight, those muscles can't really come back together, and so you can have muscle separation and diastasis. And then the other one is that, anything that causes like a lot of straining can cause muscle separation, diastasis, and weakness. Okay, so if you have a job where you're constantly lifting heavy things and you don't have like the adequate belts and stuff like that, that could potentially do it as well.
En español, Doc.
Sí, buenas.
Para TikTok, la diferencia, si un lipo y BBL es lo mismo.
Lipo y BBL es lo mismo, no exactamente, pero todo BBL lleva lipo. ¿Ok? So no existe BBL sin lipo. So, todo BBL incluye una liposcultura 360. O sea, el lipo de toda esta área, ¿sabes? El área abdominal, los costados y toda la espalda. ¿Ok? Pero, obviamente el BBL tiene la parte adicional de que vamos a hacer la transferencia de grasa a las caderas y a las nalgas. ¿Ok? So, esa es la diferencia. Pero todo BBL lleva liposcultura 360.
How do I know if I'm a good candidate for a mini tummy tuck?
All right, good question. So, how do you know? So, well, let's go back to our questions, right? So, if you are saying like, hey, my tummy's kind of flat, but I have this little pooch down here that's really bothering me. Do I have a lot of excess fat? No, not too much. Do I have loose skin? Yeah, but it's only down in here. Like I don't have any loose skin above my belly button. It's only loose in this little area below, between the belly button and the suprapubic area, just a little bit of loose skin there. And I don't have any muscle weakness and I don't have any muscle separation. Well, then you're a candidate, right? So a candidate for the mini tummy tuck is a person that has just a little bit of loose skin in that lower abdominal area with no muscle weakness and no muscle separation. And therefore, we can just go in and do a little bit of a shorter incision, just remove that excess skin. We're not going to be moving, we're not going to be doing anything with the belly button. We're not creating any incisions around there. So there's no umbilical transposition, okay? And we're not doing any sort of muscle repair. Okay, mini tummy tucks don't bring muscle repair, all right? But if you have loose skin, that you have more loose skin and loose skin above the belly button, if you have weakness or separation, then you're going to need a full tummy tuck, not a mini tummy tuck.
Can I breastfeed after having a tummy tuck? How long after that?
Yeah, it should be okay. But the thing is that it's going to be very tough to do that, all right? Because you're going to have to stop breastfeeding before the surgery. And so then it's really, really hard to then kind of have that start back up. So quite honestly, in realistic terms, it's just not going to happen. So if you had a baby, first of all, if you have a baby, you got to wait at least 6 months before your tummy tuck. You can't do it any sooner. So you can breastfeed, for about those 6 months. You're going to have to stop around surgery, and then you're not going to be able to restart that again.
I have a 12 centimeter diastasis recti and having a mommy makeover on Monday.
That's big.
Do I have a chance of having a flat tummy?
Yeah, if your muscle separation, your muscle plication, is done well, then yes, you should be able to have a flat tummy. So that's the technical term. We call it a muscle plication. That's when we're doing the muscle repair during the time of the tummy tuck, okay? Now 12 centimeters is quite a bit of a diastasis. I have my trusted little ruler here. So just to kind of show you guys how that's that much separation. So it is quite a bit, but yes, it can be fixed. Sometimes when you have that much separation, the surgeon may or may not consider adding something to reinforce the repair, like a mesh or something like that. You don't always need it, but it's a possibility, just to kind of throw that out there. But yes, once you kind of bring that together again, and you strengthen that abdominal wall, you should be able to go back to a flat tummy. Certainly much flatter than where you're at right now.
Can I replace my implants and have a tummy tuck in one procedure?
Definitely. So that's very, very common. We commonly combine a tummy tuck with a breast procedure, and it can be any breast procedure, whether it's an implant exchange, a breast aug, a breast lift, breast reduction, or breast lift with implant. Really, any breast procedure can be combined with a tummy tuck. So we do that quite often. We typically call it a mommy makeover, but it doesn't mean that it's just for mommies, right? It can be for anyone that needs it. It could even be for men when we combine a gynecomastia procedure with a tummy tuck. That's also a possibility as well. So when we talk about the mommy makeover, what we really mean is that we're just combining a breast surgery with your tummy tuck.
Do you use drains for lipo and BBL?
So I like to use a drain. It's not absolutely mandatory, meaning that if someone tells me, hey doc, I really just don't want the drain, then I'm okay with it. However, having said that, I do think they're quite beneficial. They of course keep that area down there open, so when you get those first massages in the first 5 days, the wounds don't close up on you, and they're able to push that fluid. The massage therapist can push all that fluid towards the drains, and then it'll come out the little drain tube. So I think it helps in terms of removing all that excess fluid that builds up after your liposculpture or BBL procedure. And even though the first night is still a bit messy, after that first night, if you have a drain, things are a lot more controlled. You're not just like leaking all over the place and things like that. And then typically by post-op day 5, most of that fluid is gone, and that's when we'll remove the drain. So it's not in there too long. By post-op day 5, when you come in for that visit, we're going to get rid of your drain, get rid of your stitches, and then you're good to go.
Ok. Vámonos para español.
Vamos,
Realizaría un cambio de implante a una persona diabética tipo 1 con
Sí.
A1C 6.6.
Yeah, perfect. Eso quiere decir, especialmente para alguien que tiene una diabetes tipo 1, 6.6 está muy bien. O sea, estás haciendo buen trabajo. Y ese es más o menos el límite. Y a mí me gusta que esté, para alguien que tiene diabetes tipo 1, entre 6.5 y 7, cualquier cosa menos de 7, estamos contentos. Ahora, si es diabetes tipo 2, ahí sí me gustaría que esté de 6.5 o menos, ¿ok? Pero sí, no hay ningún problema. Tienes diabetes tipo 1, hemoglobin A1C 6.6, estás controlada, you're good to go.
Can I have Vaser and body tie together?
So you definitely can, right? So you guys have maybe heard me talk about the Pure Total Definer package, right? That is a great package. It's actually absolute value. The value of that package is huge, okay? But that's where we're combining, high definition liposculpture with all our technology. So we're combining it with Vaser, we're combining it with Body Tight. We can also combine it with Morpheus if you need that as well. And so yeah, we definitely use all these modalities to help with the skin retraction, especially when we're doing high definition liposculpture to really define those areas. So yes, we can combine the Vaser and the Body Tight to try to max out the skin retraction.
I've lost 80 pounds and 20 pounds away from my goal weight.
Okay.
Can I start plastics?
Congrats.
Can I start plastics or do I need to wait? On TikTok.
Can you start inquiring about plastic surgery? Yeah, I think you can. So if you've lost 80 pounds, okay, you're about 20 pounds away. Of course, I think you can definitely start, looking into things, knowing this. Know that before you have the actual procedure, you want to be at your goal weight, meaning you don't want to do a procedure and then lose 20 pounds, okay? So you have to plan things out in that sense, but yeah, I think you can start, doing your research, looking into what procedures you need, what order you want to do them, speaking to a plastic surgeon, etc., because you're almost there. You probably have already quite a bit of excessive loose skin in certain areas that you want to be, that you want taken care of. So you can start researching all that. But just know that it's best to then lose those additional 20 pounds and be at a stable weight that you're happy with before you actually undergo the procedure.
If I had a BBL, how long after can I schedule an arm lift?
So I would say 3 months would be the shortest time. So you definitely don't want to do it before 3 months, but 3 months or later, you can schedule your arm lift. Yeah.
Okay. Do you do an internal corset when correcting diastasis recti?
Yeah, so some people refer to it that way. That's what the technical term is that muscle plication, sometimes just called muscle repair. But it is essentially an internal corset in the sense that you're bringing all that together, and to a certain degree, as much as those muscles will allow, you're gonna kind of bring in the waist during that time. Okay, so it is technically, if you want an internal type of corset. It brings everything together, it flattens out the tummy, and it brings the waist in a bit.
Okay, boom. Should I gain weight before a BBL?
Should you gain weight before BBL? Well, if you have to, right? So it depends on your BMI, what your current weight is. But yeah, there is a lower end limit in terms of BMI for the BBL. So typically you want to have a BMI of 21 or above. In some specific patients, maybe BMI of 20 might be okay, but certainly any less than that, you typically don't have enough fat to have an adequate BBL.
Doc, I need a bilingual explanation on how to get a virtual consultation, to get a quote, to get price, to get on schedule.
A bilingual.
First in English and then in Spanish. I have
Okay.
mucha gente pregunta.
Okay, yes. So a lot of people ask, how to get in touch with us, how to go through the evaluation, especially if you're out of town, different state, out of the country. And so we try to make this as easy for you as possible. So what you can do is do a virtual consultation, and the virtual consultation is free of cost. There's no cost to this, okay? And what I mean by virtual consultation, well, that means that you can go to our website, which is right here, www.pureplasticsurgery.com. And right there on that landing page, you're going to see a button that says virtual consultation or virtual consult. You're going to go ahead and hit that button. That's going to take you to a form where you're going to fill out a questionnaire, and you're going to send us some photos. We need at least 3 photos, front, side, and if we're doing something in the back, then a 4th photo, which will be the back, okay? And that's going to go directly to our patient care coordinator. And then the next thing that's going to happen is that coordinator is going to call you. They're going to answer all your questions. They're going to go over everything, and then you'll be able to decide what the next step is, okay? But a couple of things. If you're looking into more than one procedure, I understand. The form will only let you fill out one procedure. That's fine. Don't worry about it. It's going to be okay. As long as you send in that form, then you're going to talk to our patient care coordinator, who's a real human, and she's going to be able to go over everything that you're looking for, and she's going to take it from there. So don't worry about that. The other thing not to worry about, you want a video consult or you want an in-person consult. Once again, it's okay. Don't worry about it. This is not the only way that we do things. It's just the fastest, most efficient, most convenient way of doing things. But you still do go through this process. Then when you get the call from the patient care coordinator, she'll be happy to schedule an appointment for a video consult or in-person consult, okay? So that's gonna be fine. Now, I had said that the virtual consult is free. The video consults and the in-person consults are not. There's a price tag to that, and I'll let you know what that is, okay? Ahora, en español, una vez más. Ok, si quieren hablar con nosotros, hacer una consulta, averiguar sobre precios, etcétera, etcétera, la manera más fácil es hacer una consulta virtual. Las consultas virtuales son gratuitas, ¿ok? No hay que pagar por la consulta virtual. So, lo más fácil es ir a nuestro sitio web, ¿ok? Que lo tengo aquí escrito, www.pureplasticsurgery.com, ¿ok? Y cuando lleguen a esa página van a ver como un botón que dice Virtual Consult. ¿Ok? Y van a darle ese botón para llegar a un cuestionario, lo van a llenar por completo y nos van a mandar las fotos. Tienen que mandar un mínimo de 3 fotos, la foto del frente y la foto de los 2 costados, y si vamos a hacer algo atrás como un BBL, tienen que mandar la 4ª foto, que es la espalda, ¿ok? O de espalda. Ahora, si no entienden nada de inglés, también en el website van a ver una banderita de la bandera española, y si le dan a esa banderita, todo se va a traducir al español, que también se lo va a hacer más fácil para ustedes, ¿ok? Bien, ahora las próximas dos preguntas. Yo sé que el cuestionario solo te deja poner un procedimiento. No te preocupes, ¿ok? Pon cualquier procedimiento, el más que te interese, y después de eso vas a recibir una llamada de nuestras coordinadoras y ellas pueden después, hablar contigo, contestar las preguntas. Si es más de un procedimiento, ellos lo pueden añadir, así que no hay ningún problema, no se preocupen por eso. Lo más importante es llenar el cuestionario, mandar el cuestionario y las fotos para que nosotros tengamos la información y después puedas hablar con la coordinadora, que es una persona real, ¿ok? No es un robot, no es nadie que está en India o nada de eso. Es una coordinadora que tenemos aquí mismo en la clínica en Miami, ¿ok? Y la otra pregunta por general es, bueno, Doc, yo quiero hacer una consulta, o sea, yo quiero hacer un video, hablar contigo por video o te quiero ver en persona. Bueno, una vez más, esta no es la única manera de hacer consultas, pero es la manera más fácil, más eficiente. Igual mi recomendación es llenar toda la consulta virtual, llenar la información, mandar las fotos y después cuando te llame la coordinadora le dejas saber que quieres hacer la cita para el video o en persona y ella te puede agendar la cita. ¿Ok? So, esa es la manera más fácil de empezar. Alright. Yeah?
Yes, sir.
No, that was fast.
32 minutes y contando.
Oh boy. Okay. All right, everybody. Well, I really enjoyed this. I think I'm liking this kind of the way that we're doing things now. You tell me if you'd like me to kind of switch it around instead of like just talking about the procedure, taking it from the patient's point of view, and the patient say like, hey, doc, I want a flat tummy. What do I do? And then kind of going through that thought process so that you guys can then understand what's going to be the best course of action for you. Okay? All right, everybody. Well, that's it for today, but I look forward to seeing all of you next Wednesday on Hump Day with Dr. Alex Earle. Ciao.
Okay.